Hello everyone, and welcome to the Narcissistic Abuse Recovery Care Network. I'm Dean, your host of this channel, and this evening I'll be taking you on a journey through narcissism and understanding the narcissist. I'm going to be presenting episode 41, and episode 41 is titled Dialectical Behavior Therapy in Narcissistic Personality Patients. And we're not going to be necessarily discussing just narcissists this evening, but we're going to be discussing the therapies that are currently being offered or used in narcissistic personality disorder. So one of the common therapies that's being used right now since 2008 is dialectical behavior therapy. And this is being used on patients who suffer from narcissistic personality disorder that's accompanied with either bipolar disorder, dissociative disorder, or borderline personality disorder. So one of the problems is that due to the difficult nature of bipolar disorder or borderline disorder and its association with narcissistic personality disorder, these conditions can be very difficult to treat. As of the year 2021, there are no solid facts that support that narcissistic personality disorder sufferers with bipolar disorder, borderline disorder, or dissociative disorder have been successfully rehabilitated using dialectical therapy. According to the PsycInfo database and the American Institute for Mental Health and Wellness, treatment of narcissistic personality disorder symptoms within a dialectical behavior framework rendered few results due to the factors that narcissistic personality disorder sufferers were unforthcoming about their narcissistic personality disorder conditions due to their lack of acknowledgement of their existing condition and its possible mistaken diagnosis with BPD or DID. But also because the necessary elemental acknowledgement of the brain in narcissistic personality disorder sufferers disallows the patient's brain state to self-recognize the mental state of narcissistic personality disorder sufferer that the sufferer is presently in. Because the brain can no longer understand its state of being except in certain cognitive levels. Thusly, narcissists conclusively receive little benefit from dialectical behavior therapy due to their inability to process needed information in order to recalibrate brain function to a relative normal state. These are the up-to-date findings of current empirical studies. They are based on the Handbook of Narcissism and Narcissistic Personality Disorder. This information can be found in that handbook on pages 466 to 475 if anybody is actually interested in looking this up. Again, that information is found within the Handbook of Narcissism and Narcissistic Personality Disorder. This teaching text is employed by accredited psychologists and therapists worldwide and is a recognized handbook for the therapy in narcissistic personality disorder, bipolar disorder, and many other disorders of those natures. So, as of current findings, narcissistic personality disorder sufferers who may have combined bipolar disorder or borderline personality disorder are not readily treatable using dialectical behavior therapy due to factors related to comprehensive factors associated with narcissistic personality disorder and its associated disorders. Narcissists present as poor treatment subjects due to their inability to present their true selves. In other words, when they're dealing with therapists and psychologists, most narcissists will not be forthcoming with what they feel about their conditions or admitting that they are narcissists, and thusly because they cannot come to the terms of admitting that they may be sufferers of this disorder, it makes them incredibly hard to be treated properly, and because of this, this is why results being rendered as far as successful behavior with narcissistic personality disorder sufferers using dialectical behavior therapy is really rendering no solid results. If there were solid results out there, we would be able to find them in psychology textbooks. But as I said before, if you look this up in modern medicine, the modern medicine text that I have explained here, there is no solid proof that dialectical behavior therapy helps the narcissist in any other way than accomplishing very short-term results that are not necessarily solid in nature, and the results don't stick with the narcissist because their brains are not capable of actually reacting to this behavior in a beneficial way where it benefits them over time or in any permanent way. So I just wanted to talk about this dialectical behavior therapy and its usage within narcissistic personality disorder, and just give you guys a little bit of information on that, because I'm quite often asked about, what treatments can be offered to a narcissist when they're suffering from narcissistic personality disorder. And the truth of the matter is there are very few effective treatments, if almost none. And dialectical behavior therapy is really not considered to be one of those therapies that is effective in narcissistic personality disorder that is accompanied by bipolar disorder or dissociative disorder. And these are just the facts of science at the moment, as we know them in up-to-date medical journaling. So I'm just going to say, thanks for watching episode 41. I'm going to have some more episodes coming up for you on narcissistic topics. I hope you guys all have a great evening and a great day, and I'll catch you in some new episodes.